Hog Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show Fight Against COVID-19. I'm your host, Dr. Shefali Agarwal. Thank you for liking, sharing, and subscribing our show. With this show, we are able to connect to many people around the states about the great work they're doing behind the scene or in front line. There are many people making masks, helping small businesses, and providing food to the shelter. There are many recipients who are actually getting that what the other teams are doing. This is a way to connect people with the great work they are doing and the recipients who are actually getting this. Today we have a great nurse from Boston who is working in front lines but also helping nursing homes and connecting to these groups who are making masks like Suvi Care. So Kelly, welcome to the show.
Thank you.
So Kelly, tell me a little bit about yourself and what you do.
So I'm a nurse that works currently in the ICU, but my background is I started at a nursing home. That was my first job. And then I went to Melrose Wakefield, where I worked for a few years, and then I went into the ICU. But nursing homes have always been very near and dear to my heart. But recently, my uncle was actually in a nursing home and got COVID and passed away.
Oh, I'm sorry.
So thank you. But so that kind of sparked me to want to help more, because I knew that, there's a chance that it could have been prevented, that he even got COVID if there had been protection. And I wanted to help that, not happen to other people.
So, Kelly, you must be also in frontline, like you're in ICU. Do you see COVID patients?
Oh, so I work in a COVID ICU. Yeah.
Oh, you do?
ICU.
Okay.
Yeah.
So, tell me a little bit about your work and what you see, Kelly.
So I work in a 20-bed ICU, and as soon as COVID had started, we quickly had to expand from a 20-bed and take over a whole nother floor, and we have had as many as 40 intubated ICU COVID patients. So we doubled in size within probably a week and a half. So it definitely was an eye opener, and it happened early on. Probably the 3rd and 4th weeks of March is when we really saw it really pick up. So it's heartbreaking. There's really no other way to describe it.
So, Kelly, can you go a little bit back so we can actually see you perfectly? A little bit back. Yeah. So tell me a little bit about, like you said, you are in COVID floor. What do you see? And Kelly, I know it must be really difficult. How do you handle it, like when you have all these patients coming in?
It's almost like you kind of just have to, be a little bit like robotic, unfortunately, because you have to go through your tasks in order to be able to provide the best care for these patients. So you don't really have time to sit and think about how devastating it is until you actually leave work.
Yeah.
When you're at work, it has to be game-based. It's the only way to provide the patients with the care that they need. And I'm in a COVID ICU, so they're very sick.
Yeah. So, Kelly, how many patients actually come in? Like, you must be, and you said there are a lot of intubations and things like that. How are you the person who's actually taking care of these patients directly?
Yes. We have gone from taking up to 3 COVID patients within the ICU. And a lot of the times we're seeing these patients come into the emergency room. They get admitted to a floor, to a regular medical surgical floor or a telemetry floor. And then they all kind of seem to go through the same course of treatment and end up needing the intensive care unit. That doesn't happen to every single patient, but typically the patients that we do get in the ICU are admitted to a floor first and then become critical and have to be transferred to the ICU.
Okay, that's really impressive. The great work you're doing. Actually, you are the front line actually dealing with COVID patients. Do you get nervous sometimes? Like, does it scare you?
Oh, yeah, it's very scary. Like I said, though, you have to kind of just put that aside and you get kind of like a surge of energy when you're there. It's just kind of, you have to act, and you have to do your best to save these patients. So you don't have a lot of time to think about it when you're in the moment, in the shift.
Yeah. Tell me a story that touched your heart. Like you're right there in that where everything is happening and you're going there. Tell me some story that you can share.
I think the first time I actually realized how very much real COVID is was I had a patient who had come from another floor, and he was a little bit younger, like in his 50s, and just watching him deteriorate, going from using oxygen, via nasal cannula, which is often how they start, and then the next course of treatment is to use a non-rebreather. And then again, they end up desaturating on that, and then end up needing to be intubated. So I think it was a big eye opener for me, seeing somebody that was otherwise healthy and was on the younger side, 50. Seeing that was like an eye opener for me. Like, wow, this is very much real, and it can affect anybody.
And I think since you had a personal loss, I'm sorry about that. It is real for you as well. So that is.
Yeah, it's a little, it hits very close to home. And now, my uncle had kind of a similar experience when he was in the nursing home. He ended up being transferred to a hospital, a local hospital. And the same thing happened to him. He was put on oxygen. He went to a floor, and he was doing okay for a little while, maybe like 5 hours. And then he started decompensating, ended up having to be transferred into the ICU. But unfortunately was unable to be intubated because they didn't think that he would ever be able to come off the ventilator. So
that's
unfortunately, he had passed away within probably 24 hours from that.
Oh, that's very sorry. Our condolences. A lot of people talk, they're working on the side, they're supporting, I'm a cancer doctor. I'm also everybody's working on the side, but you're right there in the middle.
Yes.
And it's really tough and difficult. Tell me some of the challenges, Kelly.
I'm sorry, can you repeat that?
Tell me some of the challenges that you have.
One of the biggest challenges, I think, is having to remember, and this may sound kind of silly, but having to remember before you rush into a room that you have to stop and put on all your PPE before you can go in there. And that has very much been a challenge because, especially working in an ICU, you see this where, we have the monitor where we're watching all of their vital signs and their blood pressure starts going down, and you need to get in there quick. But then you also have to step back and think of your own safety. Mm-hmm. And it takes a minute. You have to put on a gown. You have to put on a mask, put on your goggles. When normally on a normal day, you would
just rush in,
your hands and run in. Mm-hmm.
So it's a big challenge.
I think that has been one of the biggest changes.
So tell me, of course. So first of all, we really salute you for all the work you're doing. Amid being a COVID nurse, we've got people who've helped and be on the side, but you are the real in the breadth of everything. Tell me a little bit about how Suvi Care actually helped you.
So that is actually going back to the nursing home. So after my uncle passed away, I had reached out, I had put a post on the internet and said, I really want to try to help nursing homes because, like I said, I'm repeating myself, but I do think that my uncle probably would still be alive today if they had better protection at the nursing homes, because you have to think these patients are the most vulnerable, but they don't have a lot of people coming in. So not to place blame on anybody, there's nothing that you can do, but it's most likely coming from the staff when they bring it in unknowingly, and then it starts to spread like wildfire. So there has to be a stop somewhere to that. So I had reached out about getting some protective gear for the nursing home. And then they had helped me very much by, right away, when I got in contact with them via Dr. Patel, they were more than happy. I think that within 24 hours, they had sent out 100 KN95 masks to both facilities. They said, do you have ones in mind that you want to help? And I had given the one that my uncle was at, and then one of my best friends actually is a nurse at a different nursing home that was having the same struggle. So within 24 hours, they had produced.
And so that is the K95, the other team. And then did you get the homemade mask as well, or just the K?
So the homemade masks went out also via Dr. Patel's recommendation to both the nursing, Sovicare to both the nursing homes, as well as they provided mails to both nursing homes. And I actually got a text message the other day from the social worker at Bear Hill Rehabilitation, which is one of the nursing homes that Sovicare helped, thanking me for putting her in touch with them and saying how helpful they were and how nice it was that they were sending mails. And they sent a special big mail on Mother's Day. And then they sent out caps, the head caps for the staff, and the masks. And she was saying how
so
big
there
it really need.
There are multiple organizations helping you. So you have Suvicare for masks and hats, then you have K95T, then you also have that a group of basically janitors and for care, or that group that's helping for food as well, and providing that too for the healthcare workers. So I think multiple groups helping you, and you're connecting them to different groups. That's amazing. That's a great work.
Yes, thank you. Yes.
So Kelly, when you get these things from this group, like basically as Dr. Patel had introduced you to these groups, organizations who are providing, how does it feel?
It feels great. It's so in this time is so difficult for everybody, and it's very nice when people come together, and I appreciate it so much that they are just like willing to help. That's their whole goal, is just to help people. And that's amazing, and there isn't enough of that out there. So it's an amazing organization. Truly, I'm like very much thankful to them.
And it's interesting how there are multiple organizations who are helping and teaming up and trying to provide everything: food, K95, and also masks.
Yes, it's amazing. I mean, this is a very challenging time for everybody. And when people and organizations like this come forward just to help, for nothing else, but just to try and help out, it shines a little light on like a very dark time.
Yeah. So first of all, I want to thank you for all the work you are doing. You are right in the COVID floor, doing all that, risking your life without worrying about yours. And then also you're connecting people for these organizations and getting them things like masks and food and things. So before we go, any message to the viewers, Kelly?
If I had to say a message to the viewers, I would probably, I just again want to thank all organizations for just coming together so quickly to help out. It was very beautiful. Very beautiful to see.
So, Kelly, thank you. We salute you for all the work you're doing every day, going to a COVID floor. Does it, I know you said that it's difficult, but, you still do it. Why do you do it?
I do it because I took an oath as a nurse that I will protect my patients, and I'll continue to do that forever.
That's your job. That's pretty much
my job. That's what I do. And I want to do my job well, no matter a pandemic, no matter what the situation. I want my patients all to get the same care and be taken care of the same way.
So thank you for sharing these beautiful stories. Again, we are sorry for your uncle.
Thank
you for being there for the patients and doing an amazing job. We salute you, and take care of yourself. And to my viewers, stay safe, stay strong, practice social distancing. And thank you, Kelly, again.
Thank you.
Have a good night.